for the year. It's a pleasure for me to welcome you to today's national briefing. Of course, today, we are pleased to inform us, as we can see, the CG, Controller General of Nigeria Immigration Service, Mohammed Babandede, is with us. Sir, you're welcome. We also have the Honorable Commissioner for Health, Cross River State, Dr. Beta Edu. You're also welcome to our briefing for today. The Honorable Minister of Education is also with us here. So let's formally kickstart our program for today. The Chairman of PTF and the Secretary to the Government of the Federation, Honorable Ministers here present, members of PTF, it's a pleasure for me to welcome you to our national briefing for today. To kickstart this program, it's a pleasure for me to now respectfully invite the Chairman of PTF and the Secretary to the Government of the Federation to give his opening remarks. Yes, Jeff, sir.
Distinguished ladies and gentlemen, let me start first by apologizing to members of the press for our inability to start this press briefing at 5 o'clock like we had envisaged. I think we had a lot on our plate this afternoon to deal with. However, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for today, Tuesday, the 5th of January, 2021. Let me, on behalf of the Presidential Task Force, welcome all Nigerians to the year 2021, and the PTF wishes everyone a happy, prosperous, and a healthy new year. And particularly our friends from the fourth realm. I know 2020 was a very tough year for everybody, but I'm trusting God that 2021 would bring with it the good tidings and the good things of life that we rightly deserve, provided we keep to the MPIs as we await vaccines which are on the horizon. At the last briefing to close 2020, we appealed to all Nigerians to stay safe and act in most defensive and protective ways by complying with the MPIs already prescribed. We do hope that at individual levels, you took the expected responsibility. Closely associated with that is the increasing daily numbers that we are recording. Yesterday, 4th January 2021, we recorded 1,204 infections. This was the highest daily number ever recorded since we commenced the national response. From our analysis, we are beginning to see the effect of activities carried out during the Christmas festivities. We can only hope that the numbers will not escalate beyond control. We, however, still appeal to all citizens to take full responsibility through compliance and vigilance. As at date, the statistics for Nigeria shows the following. Cumulative cases, 91,315. Cumulative tests, 958,911. Deaths, 1,318. Week 53 recorded 57 deaths, which is the highest for any single week since we started the national response. There's also a rising rate of infections among healthcare workers and this calls for escalation of vigilance. In Africa, Nigeria has joined South Africa in reporting the highest daily infection of cases per day. As we have always maintained, testing is a key strategy under the national response. To this end, we can report that there are about 100 laboratories across the country. These are made up of 71 public laboratories, 22 private laboratories, and 7 corporate laboratories. Collectively, they are to help improve testing in the country. Regrettably, however, there is still very low testing in a number of states. For clarity, the DG Nigerian Center for Disease Control will elaborate on the spheres of responsibility in testing, and the federal government has sufficiently supported the states to enable them support surveillance and IPC. To overcome some of the challenges, the Presidential Task Force would intensify the risk communication and community engagement to create awareness. The sheer level of doubts about the virus is alarming, and I call on everyone to become advocates in support of the national response. In continuation of the NYSC engagement, the Presidential Task Force has conducted the testing of batch B core members using the RDTs out of the 35,419 in batch B. 731 tested positive compared to 108 recorded during the batch A. It is on record, after we have evaluated and analyzed the data, that cases were recorded from core members from every state of the Federation. All the 36 states had core members in their different camps that tested positive. In the last 2 weeks, a lot has been discussed on case management, and in particular, the availability of oxygen to save lives. We are pleased to inform you that the private sector, COVID, has commenced supporting our response with 100 oxygen cylinders per day till the end of March 2021 for distribution to critical care centers in and around Abuja. Furthermore, approval has been given to rehabilitate 5 oxygen plants across various tertiary health institutions in Abuja. The President has also approved that at least 1 oxygen plant should be established in each state of the Federation immediately. The National Coordinator would elaborate on this during the briefing. The Presidential Task Force is progressing on the issue of accessing vaccines for Nigerians. Additional information will be provided to Nigerians on accelerated vaccines introduction and deployment plan. What is currently confronting us is a critical phase of infections globally. We are constantly reviewing our strategy to imagine situations, especially in risk communication, vaccine hesitancy, fake news, disinformation. Finally, I wish to confirm that the Presidential Task Force has commenced the sanction on passengers who defaulted on day 7 post-arrival tests. Their passport numbers have been published, and travel restriction imposed for a period of 6 months, effective from 1st of January 2021. Let me categorically state that the Presidential Task Force has generated over 20,000 inbound passengers that have also defaulted. The publication will continue weekly till the list is exhausted. Nigerians should be aware that every defaulter is a threat to public health, which is unacceptable to us and represent a drawback to the national response. We have a duty to advise our relations, friends, associates to comply with the laid down rules. The Director General, Nigerian Center for Disease Control, and the National Coordinator will update you on this. I now have the pleasure to invite the Honorable Minister of State Health, the Director General, NCDC, and the National Coordinator to brief you from the technical perspectives, and thereafter we will be willing to take your questions. I thank you all for listening, and have a very good evening.
In the Presidential Task Force on COVID-19, eminent guests here present, particularly the Controller General of Immigration, the Honorable Commissioner of Health, and the Chairman, I understand, of the Committee of State Health Commissioners, and other guests here present, media representatives present as well. Happy New Year to everyone. It's not too late for me to say that. Well, the chairman of the Presidential Task Force, I think, has already read out the status in terms of the number of samples tested so far, standing at 980,046. The number of deaths till date standing at 1,318. And we have a case fatality rate of 1.5%. The federal government of Nigeria has been making spirited efforts at ensuring availability of oxygen on a short-term basis through collaboration with CAR-COVID, while still pursuing the process for immediate intervention for nationwide equitable and sustainable oxygen availability at the federal tertiary hospitals as well as state-owned hospitals. I think on a number of occasions we did state here that our experience here in Nigeria is that we hardly need to put a patient on ventilators, because we do know that we're not saying that a patient may not need a ventilator, but we are saying that if you can prevent doing that, it's better, because putting a patient on ventilator is an invasive procedure. And oftentimes, you will necessarily, if not all the time, induce coma in that patient before you can put a patient on ventilator, aside requiring experienced ICU health workers, intensivists especially. So what we do most of the time is using oxygen concentrator to deliver oxygen to the patients. And it's one of the things patients that are really in bad shape will need. We acknowledge with thanks the provision of 100 cylinders of medical oxygen per day by a donor company for the needed support of patients in isolation and treatment centers at the Federal Capital Territory. It is important to state that the ultimate plan in terms of medical oxygen supply is based on systematic oxygen assessment and gaps identification in the country, bordering on severe disequilibrium, uneven storage-demand ratio, distribution logistics, challenges, and equipment and plant dilapidation. Our oxygen availability intervention plan is targeted at immediate, medium, and long-term plans with special attention to the COVID-19 high burden areas like the Federal Capital Territory, Lagos, and Kaduna. The various approved treatment centers have scaled up activities as directed, and quality of care continues to improve. A major factor contributing to the mortality of cases is the late presentation at the approved treatment centers. We therefore appeal to caregivers not to hold on to suspected cases who fit the case identification protocol for longer than necessary and refer promptly. This will greatly improve treatment outcomes and drive our case fatality rate further down. It is imperative during this second wave to strictly adhere to the non-pharmaceutical interventions of wearing face masks, physical and social distancing, hand washing with soap and water, and use of hand sanitizers where necessary. In this regard, we are liaising with state governments, National Orientation Agency, and other relevant MDAs to intensify sensitization of the general public on the need to comply with the existing COVID-19 protocols. Some states and the FCT have taken proactive measures to ensure compliance, such as introduction of fines for erring members of the public. In terms of vaccines, the lead agency, that's the National Primary Healthcare Development Agency, working with our stakeholders and partners, is currently assessing the infrastructural gaps in terms of logistics for cold chain maintenance, storage, supply, and distribution to ensure vaccine viability and reach all. We are also working with the Aviation Ministry to ensure strict enforcement of the COVID-19 protocols at the local and international wings of airports across the country, taking cognizance of the high transmissibility of the new strain of the virus already confirmed in some countries. Particular attention in this regard is therefore being focused on passengers arriving from the United Kingdom and South Africa. We appeal to all states to increase testing to enable us to know exactly where we are. This will enable us to put in place mitigating measures to check transmission and provide treatment for COVID-19 sick patients. We urge all those with COVID-19 evocative symptoms to report and get tested promptly. Finally, let me reiterate that the federal government of Nigeria is doing everything possible within its constitutional mandate to combat the COVID-19 pandemic. However, as citizens, it is our duty to take primary responsibility for our health as individuals. This cannot be overemphasized, especially in the light of many misleading clips on the social media denying the existence of COVID-19. Denying the existence of COVID-19 is not only making a mockery of the loved ones that have fallen victims of this deadly pandemic, it is an eloquent disservice to health workers in the arena whose brows continue to get beaten and bruised. And to say the least, it is an unfortunate and very unfair statement, and coming from some high quarters. Let us encourage one another to do the right thing, to keep all of us safe. It is the minimum duty we owe ourselves. Once again, Happy New Year to you all, and thank you for listening.
Honorable Commissioner, gentlemen of the press, my comments will be very brief. Firstly, to wish you all a happy New Year, and to really say thank you for the incredible work that members of the press have done over the past year as we've worked together, especially those of you that worked with us over the Christmas and New Year periods. Really, to say specifically, I've seen some incredible reporting by members of the media over the Christmas period that actually went into hospitals, spoke to patients, spoke to doctors, reported live from those facilities, and brought to Nigerians really the feelings, the emotions, the pain, the suffering, and sometimes the triumph of people, patients, doctors, working in these facilities, nurses, pharmacists. Your reporting makes a big difference. We might come out here every week and speak to Nigerians about the challenges that we face as a country, but it's only when you bring these stories to life that people understand the depth of the challenges that we face every day and the problems that we have to deal with. So thank you very much to all of you, some of you in this room, and some of your colleagues that have really done that incredible reporting over the last few weeks. Specifically on two small, quick issues, well, not small, but quick. On case management, we've worked very hard with our colleagues to keep improving specific aspects of this. The Honorable Minister has said what has happened and how we will continue to work with, especially the federal teaching hospitals, tertiary centers, and all other care facilities in providing critical care to the severely ill. What we've found is that it's really where people go for severe cases as where our biggest challenge is now. How we can sustain oxygen supply to these places, and we've been working with the federal government, the private sector, and all other interested parties to make sure that we can keep the supply chain of critical healthcare needs to manage severe cases flowing. So thank you to all the healthcare workers in these places that have worked really over the Christmas period. Has been an incredibly difficult time, especially in Lagos, Abuja, Jos, Port Harcourt, and Kaduna, that have seen the bulk of cases. We've interacted with many of them, and really grateful for the sacrifices that you've made, and we'll continue to work very hard to support you. The other quick point I wanted to touch on was the role of the voices from our religious leaders over this period. We have seen some bold and courageous leadership by some of our religious leaders who have spoken passionately about the need for their congregations to take sometimes very difficult decisions on how to manage their religious ceremonies safely in an era of COVID. This courage must be recommended and really noted. It has not been easy. It continues to be very difficult to do so. We understand how important religion is in our society and the need to congregate. So the sacrifices over this period in limiting that in different ways, different innovative ways, sometimes holding services outside. Sometimes limiting personal interaction has been challenging for all of us, but necessary. So we'd like to really encourage you. Right now, we can see some light at the end of the tunnel. The tunnel is still very far, so to get there will still take some time. But this is really to applaud and acknowledge those of you that have been bold enough to adhere to advice and really limit the opportunities of gathering over this period. And it's necessary to continue to do so well into the new year. For us, our work continues, the response continues. Together with the World Health Organization, we've just deployed large teams again to 4 states in Nigeria to support the response. We continue to support laboratories across the country to develop the work they're doing, keep the supply chain flowing, make sure that colleagues feel supported across every state in Nigeria where they're working very hard to sustain the response. So at the beginning of a new year, all I'd like to say is bon courage as we continue this hard work in 2021. I know many of you are tired. Sometimes I'm tired myself, but we know we can't really afford to get tired until we're on top of this outbreak. So wish you all the very best in 2021. Thank you.
Nigeria Immigration Service, Honorable Commissioner of Health, Cross Rivers, gentlemen of the press, good evening. So I'll try and keep this brief. Well, first of all, as we know, various parts of the world are now witnessing a surge in COVID cases. And the PTF would like to reiterate the importance of continuous adherence to non-pharmaceutical interventions. There's no doubt here in Nigeria, we are experiencing our own second wave, which is now sweeping across the country. For those of you following our numbers, you will notice that when we compare ourselves with 3 weeks ago, the number of new cases per week has tripled. We were running at around 2,000 cases a week. We've now exceeded 6,000 cases a week. 3 weeks ago, if we take 100 samples, we get 4 positives. We are now getting 16 positives. In November, in Lagos, 5 persons died of COVID. In December, 26 died of COVID. In Abuja, in November, 2 persons died of COVID. In December, 18 died of COVID. And these are all preventable deaths from a disease that we know we can protect ourselves from. So there's no doubt we are in great danger, and hence the reason why we continue to talk about these non-pharmaceutical interventions. We know that vaccines are available, but these vaccines are not here yet with us. And even if you had a vaccine today, based on the vaccines that we currently have, it will take at least a month to get a good immune response because you will need a second dose. So why not use the vaccine that we have already here, which are the non-pharmaceutical interventions? Yes, there's no doubt that we are all tired. We wish we had left COVID behind us in 2020, but sadly that is not the case. COVID is still very much with us. So we'll continue to urge the general public to please comply with our non-pharmaceutical interventions. They work, they will protect you, they will protect your loved ones. And in the same vein, we are asking state governments to please set up task force teams that are empowered to make sure that people wear face masks in public and observe all the rules that we have put in place. It should be socially unacceptable to come out without a face mask in public. It really should be socially unacceptable, and it's about time that we start putting in place measures to compel people to do the right thing if we cannot convince people to do otherwise in terms of their change in behavior. I will briefly talk about the issue of testing. Testing remains critical in our fight against COVID-19. It's important that we identify new cases and we comply with the prevention advisories. Last week, we tested about 37,000 samples throughout the country. Abuja had over 9,000 samples tested. Lagos had over 7,000 tested. 3 states tested only 6, 11, and 26 samples. There's one state in the country that, despite in total having more than almost 1 million tests done so far in Nigeria, but with one state, they've tested less than 500 since the epidemic started. Now, we know that there are challenges with some states. So, Honorable Commissioner, we've discussed your state specifically because of the issue of your laboratory, and we have assurance from NCDC that they will do something about it. But we are really appealing to state governments to pick up the tab and make sure that testing is available at your state level rather than taking samples and sending them centrally to Abuja. A week ago, over the holiday period, at one point we had over 16,000 samples at the National Reference Lab in Gadua because the laboratories across the country had closed for Christmas and the New Year holidays. But surely if you are running a pandemic, if you're having a pandemic, would you really close for holiday? So we appeal to the states to please pick up the tab. There are more than 70 public health laboratories throughout the country. Testing is free when it comes to public health. If you are traveling, yes, you have to pay, but if you are not traveling, you should be able to get a test done. There's a lot of COVID around. The symptoms, as I would remind you, the commonest symptom is a fever. If you have a very high fever, together with respiratory symptoms, cough, and especially if you lose your sense of smell or taste, almost certainly you probably have COVID, and you really should go and have a test done. The problem with COVID is even though the majority of people would be well afterwards, 80% at least will have a mild illness. But you just don't know where you are in the spectrum because a small number will have very severe illness. So it's like playing Russian roulette. You can catch COVID and have mild symptoms. You can catch COVID and end up in intensive care and possibly die. We know that age is the strongest factor. From the age of 50 onwards, your risk of dying with COVID in Nigeria is about 1 in 5. So people like us that are already middle-aged, surely we should run away from COVID when we are shown COVID. And the best way to protect yourself is really to assume that everybody you meet has COVID. Everybody you meet has COVID. That way, you'll be able to protect yourself because you wouldn't allow somebody with COVID to come near you without a face mask or to cough in your face. You wouldn't hold his or her hand. You wouldn't embrace them. You wouldn't allow them to come too close to you. So the best way to enforce protection is to assume that that risk is there with everybody you meet, regardless of whether you're in an office situation or at home, if you're having a visitor, etc. And if you have to go into a gathering, preferably do it outside. Because if you do it outside, you have at least a 19-fold lower risk of catching COVID if you are coming across a positive person than if you are meeting the person indoors. So there are various ways of reducing risk, and it's really important that we realize that and we follow the rules. And that brings me to the issue of traveling and the 100 passengers that we have restricted their passports. We're very grateful to the CG Immigration. And just to clear the air, we have worked with the Nigeria Immigration Service every step of the way over the last few weeks. to make sure that this comes in. I'm sure most of you will be aware that in September, when the new travel protocol came out, we made it very clear that if you do not comply with the protocol, there will be repercussions. And these repercussions, we spelled it out very clearly, that your travel documents will be restricted and you will not be able to travel out of the country for 6 months. 3 months we've been monitoring this. We had over 160,000 passengers in the last 3 months. Less than half bothered to pay for the test. Of those that paid for the test, more than a third did not even bother to go for the test at day 7. And we are not interested in the money because government is not involved in testing within the private sector. The PTF, the federal government, NCDC, etc., nobody gets a single kobo from testing in the private sector. What we are interested in is to make sure that you do not bring in COVID into our country. So we are interested in making sure that when you come in, you self-isolate for 7 days, and we know your status at day 7 before you exit. We have appealed, we have cajoled, we have urged travelers to do the right thing. But it was very obvious that things will not change unless we apply the penalty, which was why we applied the penalty. We have already published a list of 100 passport numbers of people that are restricted from traveling for the next 6 months. We have over 20,000 passport numbers of those that have not complied with our protocol. We will continue to publish 100 fresh lists every week and monitor the compliance until such a time that we note a significant improvement in compliance. If the compliance improves in the next 1-2 weeks, we will not continue. It is not in our best interest to penalize people. But if we have to, for the sake of public health, we will. And I'm very pleased that the Nigerian Immigration Service has supported us in this endeavor. Before, we were taking passengers' passports and holding them at the airport until you come back with your negative PCR result. That is not possible now because of the number of passengers we are having coming through the airports. And that's why we had to go electronic. This would also include people with foreign passports that come into the country and do not comply with our protocol. The next set of 100 will also have non-Nigerians that have not done their test at day 7. And we will ask for their visas to be revoked if they are in country. If they're outside the country, if they have a long-term visa, we will ask for their visas to be revoked so that they are unable to travel to Nigeria for a period of 6 months. But from now on, the gloves are off. As far as the travel protocol is concerned, we are enforcing it 100% to make sure that our country is safe. We have already risks from the UK and we have risk from the South African strain. We cannot afford to have an importation of a strain that will end up completely messing up our current response. So we really want people to comply with this protocol. When it comes to exit testing, we know that there are issues with fake results. If you are exiting the country to travel abroad, please note that not every country requires a test when you are leaving the country. It is your responsibility to check with your airline and the country, the embassy of the country you are going to. Do they need a COVID-19 PCR test? If they don't waste your money to do a test. But if they do, you have to use the travel portal, enter your details, print out the QR code, and then go to a laboratory, an accredited private laboratory, to do your test. Get your result, because from next week we're going to start asking the airlines to cross-check the QR code you have when you applied for the exit testing on the portal with the result that you are holding. So unless you use the portal, you will not be able to validate the test result you have. So those passengers that go to the airport or go somewhere else and buy a fake COVID PCR result, from next week, we will have a system that would allow us to trace them. And if we trace them, they will definitely face the law. So hopefully the issue of fake tests will no longer be a major issue. So once again, I'd like to appeal to the public to please comply with our protocols and guidelines, and also appeal to the state governments to take the lead when it comes to the enforcement of our protocols, as well as advocate and sensitize the public for testing. Thank you very much.
Thank you very much, the National Coordinator.
Today I'll be giving an update on the status of COVID-19 rollout in Nigeria. By way of background, as a result of the pandemic in 2020, many countries and pharmaceutical companies invested heavily in developing candidate vaccines. A few of these, namely the messenger RNA and protein vector types, have been approved for use based on data which indicated up to 95% and 76% efficacy, respectively. The approval is for emergency use authorization. The messenger RNA vaccines, as you are well aware, were developed by Pfizer, BioNTech, and Moderna companies, while the protein vector vaccine was developed by Oxford and AstraZeneca. In terms of the delivery platforms to countries, at the outset of the COVID-19 pandemic, global partners came together to establish a platform that will ensure and accelerate fair and equitable access to diagnosis, treatment, and prevention tools against COVID-19. This platform is known as the ACT Accelerator. The vaccine pillar of this platform is known as the COVAX facility. This pillar is driven by the World Health Organization, UNICEF, Gavi, the Alliance for Vaccines and Immunization, and CEPI, the Coalition for Epidemic Preparedness Innovation. The COVAX facility has 192 participating countries, including Nigeria. This platform is currently the mainstay of our expected access to safe and effective vaccines. The COVAX vaccine facility has in its portfolio the following approved vaccines: the Pfizer, BioNTech, the Moderna, and the Oxford AstraZeneca, including hundreds of candidates' vaccines still in development. The African Union has also set up an African Vaccine Acquisition Task Team, AVAT, to provide an all-of-Africa approach to negotiation for more vaccines from developing countries and pharmaceutical companies. However, apart from the COVAX facility and the AVAT approach, Nigeria is also involved in multiple conversations with the governments of Russia, United Arab Emirates, and India to access the Sputnik V, Sinopharm, Covaxin, and Covishield candidate vaccines. Poignantly, moving forward with any of these aforementioned vaccines that have not received certification for emergency use authorization will be predicated on their transparently sharing results of their clinical trials and approval by NAFDAC. Another question on many people's minds will be the timelines for access to these vaccines. In the first phase, through the COVAX facility, we expect to receive approximately 100,000 doses of the Pfizer-BioNTech vaccine by the end of January. A letter announcing this allocation is being expected from the COVAX facility this week. In the second phase, also through the COVAX facility, Nigeria is expected to secure free delivery of 42 million doses of vaccines, which will be a combination of all the available and approved vaccines currently in the market. This is expected to cover about 20% of the population. In order to achieve eradication of COVID-19 in Nigeria, we need to cover 70% of the total population with COVID-19 vaccines. 40% will be vaccinated in 2021, while 30% will be covered next year. The priority will be given to frontline health workers, first responders, strategic country leadership, and those that are elderly and with comorbidities, that is, those that have other diseases apart from the COVID-19 infections. In terms of financing the cost of additional vaccines and their delivery, there are three components to the total cost of delivering vaccines to Nigerians. The first one is the cost of procuring the vaccines. The second one is the cost of delivering the vaccines to every ward. The third one is the cost of ensuring that the primary healthcare centers and the health workers are available to deliver the vaccines safely and effectively. In terms of the cost of procuring these vaccines, in collaboration with the National Primary Healthcare Development Agency, the Federal Ministry of Health, and other critical stakeholders, the Presidential Task Force on COVID-19 is finalizing the cumulative financial requirements for deploying vaccines to the last miles. I'm sure that in the next couple of days, the finalized figures will be made available. On vaccine hesitancy, we already see a situation where there's evidence of resistance to the uptake of the vaccines even before they have arrived the country. It is clear that we, as scientists, public health experts, and even the media, need to do more to educate people on the nature of the vaccines, how they work, and the steps we're taking to ensure that only safe, potent, and effective vaccines are delivered to Nigerians. We must acknowledge that the average non-health worker may not necessarily have all the information required to make an informed decision. We must continue to not only offer the vaccines, but we must put in the hard work, the effort, the time, and the resources that are required to inform the general public. It is only human that we fear what we don't understand. What we fear, we judge as evil. What we judge as evil, we attempt to control. And what we cannot control, we attack. This happens in every facet of life. So that understanding around the vaccine needs to improve, and I'm sure that many people will come around. So at the PTF, we're urging all well-meaning individuals to desist from spreading false and unverified information about vaccines in general. The chairman of the PTF has reiterated this. We will continue to work with critical stakeholders to provide the correct information about vaccines and assure all Nigerians that the issue of delivering vaccines that are safe and effective is something that we take seriously. It is a responsibility that we will discharge with the highest level of ethics, integrity, and accountability, so that we are assured that all Nigerians will together see the end of COVID-19. I thank you all for your attention. God bless you.
Thank you very much.
My name is Mitaire Ikben. I report for the NTA. My first question is for Dr. Faisal. I want you to explain what you mean by vaccine for emergency use. It could be confusing for some people. They might not know whether it means vaccine for critical cases or for preventive purposes. So what do you mean by vaccine for emergency use? And I also want to ask, in spite the non-pharmaceutical interventions, which we have always preached about, we have had some Nigerians who take all these necessary precautions, still contracting COVID-19, in spite and despite of adhering to these non-pharmaceutical interventions. So that also means that there is a percentage risk of still contracting the virus despite adhering to these non-pharmaceutical interventions. In fact, there is a particular case of a prominent Nigerian who is called Mama Face Mask, still contracting the virus. So some Nigerians are wondering, shouldn't the messaging also include what Nigerians should take to boost their immune systems so that even if you adhere to the non-pharmaceutical intervention and there is still that percentage risk of contracting the virus, you would have some measure of all-round safety. So I think the PTF should work on that. Thank you.
Good evening all. Rachel Abuja. My question is for the WHO rep. So just recently, WHO cleared 2 vaccines and said it's going to be for emergency use. So I would like to know what strain of this vaccine, or what strain was used to produce this vaccine? That's one. And when a report on vaccine says 95% efficacy, what does that mean? And I'd also like to know what's the difference between efficacy and effectiveness. Thank you very much.
Good evening. My name is Hassan Umar Farouk. I report for Liberty Radio and Television. My question is to the Comptroller General, Nigeria Immigration Service. If it's the reason for publishing those defaulters, the passport numbers in the newspapers, if the reason is name and shame, why only the numbers, no names? Mai girma Comptroller General na hukumar shige da fici, za mu so mu ji hikimar bayyana lambar fasfo na mutanen da suka karya doka. In akwai wata hikima ta bayyana waɗanda suka karya waɗannan doka, me yasa lambobi kawai kuka sa ba tare da sunayen waɗanda suka karya wannan doka ba, yadda 'yan Najeriya za su gani kuma hakan ya zama izina ga waɗansu kada su karya dokar? Na gode.
The Chairman, National Coordinator, members of the PTF, my colleagues. My name is Amaka Ode. I report for Arise News. And my first question actually goes to the Primary Healthcare Executive Director, Dr. Faisal. Thank you so much for joining us. What more are you doing? Because we know that before even the vaccine gets to Nigeria, there's already vaccine hesitancy. I know that you had spoke about using a strategy that you used for polio and all of that. Is that changed now? What strategies are you going to use to ensure that people, when the vaccines arrive here, will be willing to go out to get vaccinated? And the next question actually was sent in, and it was sent in from a viewer, and it's actually addressed to Dr. Sani. It says, considering the exponential rise in COVID-19 cases and given the apathy of the public to non-pharmaceutical interventions, what are the options at the expense of the PTF to change the attitude? Thank you.
That is the outlook for our questions today. So we'll call on the Honourable Minister of State for Health, the usual order that we'll take. Okay, Honourable Minister of Education will take.
At the last count, about 12 states have already announced that they are opening their schools between 4th January and 11th. And they are right, they don't take their orders from the Federal Ministry of Education because there is concurrency in the Constitution as far as education is concerned. And I really wish somebody could take away that concurrency for me so that I will force the states to do what PTF has said. And the second part of her question, she was asking what we are doing new. You know, the old virus and the new virus, no matter how virulent a virus is, I think the attitude to keep it away is the same. We are appealing and enforcing in schools. Our students keep to standards of hygiene dictated by the health authorities, and they wash their hands, and they use the mask, and then they keep social distancing. So whatever virulence the virus has, I think this will keep it in check. Thank you.
Nancy, you asked about Cross River, and I'll answer, and then I invite the Honorable Commissioner to come and also update Nigerians on the situation, since she's just come from the state. Like I've always said, our role is to support the states, is the reason for our existence. With this particular response, in every state, we generally have two institutions. The state, who, whatever we send, whether they're PPEs, whatever commodities, the bulk of it goes to every state. But we also support the federal institution in every state, either the tertiary, either the teaching hospital, as is the case in Cross River, or the Federal Medical Center. Unfortunately, we know that one of the fallouts of the End SARS protests in Cross River was the destruction of the Dr. Lawrence Henshaw Memorial Center, where the state has a lab, and that was actually the lab doing most of the testing in Cross River. So that has been disabled since then, leaving us with the lab in the University of Calabar Teaching Hospital. That particular lab has a gene expert machine. So with gene expert testing, there's no ambiguity about the result. It's either positive or negative. There was a backlog of samples that hadn't been reported into the system. So when it was reported, that's where's Nancy? That's where the 75 cases came from. So those were uploaded into the system, and that accounted for the sudden increase. The fact is that given the circumstances in Cross River, the destruction of that lab, we have a huge deficit in testing that we now need to catch up to really understand where we are. And there are a number of states that have not tested as many as we would like to achieve the 2% per population target that has been set for us as a country. So we'll continue to work hard with the state to achieve this. We're working to support Cross River in rehabilitating the Dr. Lawrence Henshaw lab. We have 85% of the equipment needed. We haven't sent it to Cross River yet because if you're building a car, if you have 85% of the parts needed, the car will not move. So you need to have everything. So we're waiting for 15% of the equipment, then we'll take it down and we'll support the state in rehabilitating the lab equipment specifically, while the state takes responsibility for the physical infrastructure, security, human resources, as is done in every state. So I hope that answers your question. The truth is, everybody has been working very hard to increase testing, like Dr. Sani said. This is the only way we can understand what is going on, so that we prevent getting to the situation where we are in some states in Nigeria that are really suffering under the burden of cases. Their hospitals are inundated, a really difficult situation in managing cases, which is really what we want to prevent. So you can only manage what you measure. You can only measure burden by testing for this particular virus. So let me invite the Honorable Commissioner to elaborate a little bit on efforts going on in Cross River to really reinvigorate the response. Thank you.
Inviting me to speak. Apparently, a lot was going on in Cross River State, starting from the fact that, of course, we had a strong task force that ensured people use their face masks in public places. We had the garment factory producing face masks, over 1.5 million, distributing to Cross Riverians free of charge. And then, of course, the testing was going on. We were doing community sampling, contact tracing, surveillance was on top notch until we had the NSAS protest in October. And the NSAS protest affected the reference laboratory, which we offered 24-hour service to members of the public. And we also had the NSAS protest also affecting destroying, vandalizing, and looting the 100-bed isolation center. This left Cross River State without a public lab where we can have members of the public come in for tests, where we can bring in large, huge volumes of samples into the lab. And then, of course, right now we just have the 14-bed space in the entire state, which is 4 at the University of Calabar Teaching Hospital, and then 10 in the General Hospital, Ogoja. However, like the DG and CDC has said, and indeed the chairman of PTF, the governor, Senator Professor Benayade, is not resting on us, is working with the relevant authorities to see that we can get back on track, get at least a molecular lab or a reference lab back so that we can test large volumes of samples, and we can also get the isolation center back to help us deliver well to our state. What's most important is the fact that we want to be able to do surveillance. We want to be able to continue to test large volumes. We want to be able to do proper patient care in isolation centers or home care where it's necessary. And we want to be able to protect our citizens. And we would work with the relevant authorities to do this. Thank you. Okay, so some states in Nigeria got funding very early in the whole response, but majority of the states, I think about 34 states, got support from the PTF in October of last year. Each of the states got 1 billion naira each from the federal government of Nigeria, and we're very grateful for that support. It helped a lot of states with surveillance and to ramp up testing. However, for Cross River State, of course, this money came quite early in October, and we had bought in a lot of things, PPEs, several things which we needed, some of which were now affected during the vandalization, looting that followed the NSAS protests. Others are still available, and we're trying to see how well we can use that to improve on the response. But going forward, a lot of support is still needed by state government. We're happy that NCDC is working with the World Bank and, of course, the PTF on co-prep, and we believe that these fundings will be made available to states as soon as possible. We're also expecting vaccines to come in, so a lot of work still needs to be done on the cold chain system, risk management and communication rumor management, and several other things. So we're believing that PTF would also support states again as we try to increase testing and case management across the state while we prepare for the vaccine and immunization across the board. Thank you.
Thank you very much.
People who had used the public laboratories for testing when they came back from abroad. So let me explain what happens. We have a travel portal. If you're outside the country, you're supposed to do a COVID PCR test that's negative within a certain time period before you board. It's 120 hours. We are now bringing that down to 96 hours before you board. You then go onto the travel portal. You enter your details. There's a health questionnaire you fill. You then upload your COVID PCR result, and you pay for the test at day 7. There's a reason why we want passengers to use the portal. In the first instance, it's easier for us to locate the passengers if things go wrong. Secondly, we're moving away from paper to paperless system. We cannot trace somebody who is positive based on a test at day 7 if it's a paper copy, because the paper copies will probably occupy a whole room. You can imagine 160,000 passengers over a 3-month period. So that's why we're insisting that the portal should be used. If you come in, you self-isolate and you test at day 7 at the laboratory that you have chosen and you've paid for. There are certain groups of passengers that we have excluded from payment. So for instance, if you are a deportee, we will make that arrangement for you to be tested at day 7 at our own expense in a public laboratory. If you are a child below the age of 10, we don't expect you to pay and have a test. And in the same way, if you are a diplomat, we have excluded diplomats in line with other international protocols. However, if you are a passenger, you come back, and at day 7, you go to a public laboratory to test. Yes, we're very much interested in your COVID status. And if you show us that evidence, we would not penalize you. But we don't want passengers to use the public laboratories for testing. Why? Because of the number of passengers we get per day. You are using resources that are supposed to be applied for public health purposes. If we're getting 5,000 passengers a day, for instance, when we are fully open, that's what? That's 150,000 passengers in a month. If they are all using public laboratories, on average, NCDC do not have more than 500,000 test kits at any time. 3 months, gone, exhausted. The country cannot afford that. We cannot afford that. Even in the UK, if you are traveling, you do not use the NHS 111 for testing, because travel is a personal pursuit. And we must remember that before September, our flights were closed. There were no flights at all. So this is the sacrifice that passengers have to make in order for us to keep our airports open and to keep our country safe. So let me re-emphasize again. You come from abroad, you decide not to use the portal, you go to a public health lab, you don't test at day 7, based on what they've said, you tested 3 times. If you test beyond day 14, we're not even interested. Because beyond day 14, we're not going to capture you if you came in with the infection or you're incubating, because that goes beyond the incubation period. The purpose of the travel testing is to pick up those that have become infectious after they have arrived to the country, but not to pick up those that became infectious because they had community transmission 2 months later. So we are interested in your test from day 1 of arrival up to day 14. Beyond day 14, you are not following our protocol. The way we got the 100 numbers, and the reason why we restricted ourselves to 100, is because we have to go through each and every person on that list, call them, have a discussion with them, and by the way, it's a taped conversation. Did they have a test? Yes or no? If they didn't have a test, why didn't they have a test? Was it because of a system issue we had? Were there any explanations that could potentially make it unjust for us to put any penalty on them? And then, based on that, we put the passport number down. And so far, we've got 100. We actually started with 200, and then we phoned them and got 100. And this is why every week we'll pick another 100. We could have done 1,000, but because of the amount of due process involved before we finalize the list, that's why we're keeping it to 100. But when it comes to the purpose of putting restrictions, travel restrictions, is not to name and shame. Because if we just wanted to name and shame, we'll just put the passport numbers and the names and not put any penalty. You've named and shamed. No. The purpose is to make sure that travelers change their behavior and comply with our protocol. In other words, this is enforcement. We cannot put passengers' names because you will be breaching confidentiality. Each of those passengers knows that they have been called, and they know they are at risk of their passports having restrictions put in place. And after we took the decision to put restrictions, we contacted them, and those that we were unable to reach again, we sent text messages. Please note that following our discussions with you, we have investigated and we have decided to impose these 6-month restrictions. But I'll keep on saying, we delayed implementing this because we were hoping that just by warning passengers repeatedly, people will do the right thing. And we've been pushed to the wall, and from now on, the gloves are off. If you do not comply with our travel protocol, there will be repercussions. It doesn't matter how high in society you are. There will be repercussions on this. I will briefly talk about the issue of non-pharmaceutical interventions. There's a very important question that was asked. I think it was Mitari. Why is it that some people follow non-pharmaceutical interventions, but they still catch COVID? Well, for a non-pharmaceutical intervention to work, you need to do it consistently. So as far as the virus is concerned, if I wear this face mask for 18 hours a day, and then I sit down with friends and I take it off and I have dinner, and one of them is infected, the virus doesn't really care that I've protected myself for 18 hours. It will still go in. In the same way, if I gel my hands, sanitize my hands, and I happen to go to a hotel, somebody is coughing on a table and I sit down, I touch it and I touch my face, the virus will get in. So if you're protecting yourself, you need to be consistent all the time. And one of the breaches that a lot of people don't realize is if you go for a meeting, for instance, as with all meetings, you have opportunities to have tea, to have lunch. So you're in a meeting room, you're all wearing masks. You leave the meeting room, you sit down by a table to have tea. All of you take masks, you laugh, you chat. That's an opportunity. And the likelihood is it's those breaches that give the virus the opportunity to get in. The virus will never get in. It will never jump 6 feet from somebody else and get into you. Neither will it open the door to your house and get in. Somebody will have to carry it in. So that consistency in implementation is so critical. And that's why I keep on saying, whoever you meet, assume that person has COVID and act in a way to protect yourself. And if you do that consistently, it mitigates the risk. In addition to that, it also depends on everybody doing it. So let's say with a face mask, for instance, I wear a face mask, I go into a crowd, and people are not wearing face masks. Even though I'm protecting my face, my mouth, and my nose, I'm not aware of any face mask that protects the eyes, for instance, unless I'm going to run around blind. So the person who's not wearing a mask, if they cough at your face, they are very close to you, and you're wearing a mask, you still catch it. So that's why it's also collective responsibility. It's all of us making sure that we protect ourselves, and that way we do not give the virus the chance to spread. And by the way, I don't believe in any drugs that will boost your immunity, Mitari. And the best way to make sure that your immunity remains is you take a good meal, not to spend tons of money on multivitamins, etc. In terms of the issue of, there was a quick question about options to change attitude. What are the options to the PTF? Well, I've talked about collective responsibility, doing the right thing, but we also are aware of the need for us to continue to improve on our risk communication and community engagement. It's not just about the message, it's also about the messenger. So engaging with our traditional rulers, our religious leaders, and pleading with them to please continue to be on our side and help us in this endeavor. People are starting to die from COVID in significant numbers in the country. A lot of people are catching COVID. The 1,200 we are announcing that had COVID yesterday, that's just a fraction. For every positive, we are probably missing between 7 to 10 cases. So it's a gross underestimate. We say 57 people or so died of COVID last week. The likelihood is tenfold that died. It's just that they didn't make the news, and neither did they have a test done that was positive. So we'll continue to work on risk communication and community engagement. We'll continue to engage with the state governments, because I strongly believe in addition to change in behavior, we also need to enforce rules. If you go outside the country, there's a specific country in the Middle East where a lot of people go for holidays. At the moment, if you go there, you go out without a face mask, you are penalized straight away. You are made to pay a fine. And Nigerians all carry masks in that country. Why should you come back home and run around without a face mask? So enforcement is necessary, and we are pleading with the state governors to work with us, because enforcing at the local government, at the local level, is not the responsibility of federal. It's a responsibility of the states. If all of us had continued to use face masks and comply with the non-pharmaceutical interventions back in March, April, when this thing started, this would have been over by June, July. The particular country I'm mentioning in the Middle East, their businesses are open, all their shops are open. Everybody is doing his or her activities, but they're all wearing face masks, and it's not affecting the economy. But here we are in January having a major surge in infections and having a risk of going into lockdown again. Which takes me back to the final statement. All options are on the table. Government will not sit down and allow people to start dying in huge numbers from a preventable disease. If we do not want another lockdown, now is the time for us to comply with those non-pharmaceutical interventions. Thank you.
The staffs at the airport could compromise. Yes, when the government was only collecting passports, you remember? There was a time when directive was given that passport would be collected, and when you conduct the test, your passport will be released. There were publications by some of you in both print and electronic media that there were compromises. I took an Emirates flight, just as a sample, that had arrived 2 days. And I went to the airport myself. We looked for all the passports for that aircraft. Around 20 passports were missing. 20 passports were missing. And since we have a system that we can know who cleared that particular passport holder, we are able to find around 3 officers who had compromised and given the passport, and they have been punished. They are going disciplinary procedure. But now, it's a different setting. What the PTF told us to do is to block their passport. It's electronic. So it is not done even in the airport. It is done in the service headquarters. We have already fed into the system that these people should not be allowed to depart and should not be allowed to reissue their passport in case, people will just go and declare and say they have lost their passport. So that passport number will go up. So in case they declare the passport missing, they go to any passport office in the world. We have 89 passport offices in Nigeria and abroad. Once they submit their fingerprint, it goes to the central database. The system will reject it. It's called office reject. So that passport cannot be reissued. If you come to the airport, you scan that passport and the name. That particular officer who is doing the scanning system, a red alert will arrive, and his supervisor will know, and headquarters will know that wanted person is crossing the airport. He cannot do that clearance until his supervisor comes and takes the person. So the possibility of compromise is not there. This I assure you, because it's electronically controlled. And it is a possibility that we can analyze
even at the time when he hits the suspect index. Once he hits the suspect index, we'll know. And the officer cannot continue clearance until the person is picked. And some of you have passed through our airports now. You have seen our airports, it's no longer just an issue of photograph. We swap your passport, we take your biometrics, we also take your photograph. So it is not possible to compromise. The second question is not mine, actually. It's supposed to be for the coordinator, asking me why they didn't print names. Me, I don't print names. The only story I gave to the media is that we have complied. That's my job. I complied by blocking, that's all. But the details, I think he has stated that he's not interested in naming and shaming, but punishing. So that has been also answered in Hausa. There was a question in Hausa. Ni ba ni na buga ba, za a tambayi Dr. Sani. Sorry for answering in Hausa because that's my language, unfortunately. Ba ni na tsaye da fasfo ba, hakki na shine na tsaye da mutane. Wanda suka buga shine committee na shugaban kasa na COVID-19. Kuma na tabbata sun ba su da niyyar su walakanta kowa, so suke a hukunta mutum. Shine dalili. Thank you very much.
Authorization is really a very rigorous method to facilitate the use of medical countermeasures, including vaccines. It is based on the available scientific evidence that is provided, for example, to NAFDAC or the Food and Drug Administration in the US. So the regulatory entity looks at all the data and then makes a determination that in this kind of public health emergency like we have with COVID-19, is this product good enough to use? We do have a plan to have a session with you guys in the media where we can provide additional information on what we're doing around COVID-19 and then also some training around some of these terminologies that you might not be familiar with. On Wednesday and Thursday, we have Zoom meetings with editors and a select number of health journalists. But I'm sure that we'll be able to schedule a session with you guys so that we can have more deeper discussions around what's happening in the COVID-19 space. The second question was from Arise TV. This was around what we're doing to increase awareness around COVID-19. We're working with critical stakeholders like the NCDC, we're working with the Ministry of Information, with the Federal Ministry of Health. Again, we're using the template that we've used that helped us to successfully eradicate white polio viruses in Nigeria. That means working with traditional leaders, religious leaders, really working from bottom up. We've already started engaging, some of these individuals that have come out publicly to say things that are incorrect. We do not think that they are trying to be mischievous, but if the information that they have is not correct, then we have to, as a body, engage with them to provide the right information. Again, like I mentioned earlier, it is not just about offering the vaccine, it's also the effort and the resources required to make sure that people have the correct information, they're well educated about the vaccines. In terms of what we're doing presently, so we have 3 phases of our approach towards communication. Before the vaccines arrive, we're trying to build trust around the safety of the vaccines, providing the right information. By the time the vaccines are here, we will try to increase demand for the vaccine. Again, continue to increase awareness around the vaccines. There are questions around why it took such a short time. really providing the information around how these vaccines got produced, the safety, and like we've seen in the developed world, I'm sure that a number of our leaders will come up and take the vaccines as well. I will take the vaccine in the full glare of the public, just to assure people that the vaccine is safe. I'm sure the chairman of the Presidential Task Force as well will do this. So notable Nigerians will take it, and I'm sure that because so many people have taken it in different countries, and we're seeing that the side effects are minimal, then we'll be able to build that confidence. Just like any drug, there are some people who react to specific drugs. Some people might react to the vaccines. And that is why there's a clear information that you have to look and make sure that some of the components of the vaccines are not components that you react to. It is our responsibility, and like I mentioned earlier, the Presidential Task Force is upping the ante in terms of trying to communicate very, very clearly that these vaccines that will be brought to Nigeria will be certified safe and effective for use by NAFDAC, and I'm sure that just like all the other routine vaccines that have been given to Nigerians, we'll make sure that they are delivered in an environment that is safe for all Nigerians. Thank you.
Start by complimenting Dr. Faisal on the emergency use list, which is a procedure to authorize utilization of procedures, vaccines, or medicines that are still under investigation. So you know, before WHO will approve utilization of product, they have to go through a rigorous process. But the emergency use authorization is issued when the world is confronted with a major epidemic or a major outbreak or a pandemic such as the COVID-19 as we are facing now. It's an authorization that WHO issues as soon as the first available evidence indicates some level of confidence that the procedures, the treatment, or the vaccine might work when it has been administered on the first group of individuals. It's done on a compassionate basis. Rather than having more people dying, if we have a treatment that has proven effective in a group of individuals, why not test it and try to curtail the epidemic? So it's in that context, it's still investigational. So we use it as we collect more information on actual efficacy. So it's really a special case done only when we are confronted to major emergencies, outbreak or a pandemic like now. So now the question of WHO endorsing, authorizing 2 vaccines. What I can say, as of this evening, WHO has endorsed for emergency use list 1 vaccine, which is the Pfizer vaccine, which is the one Dr. Faisal was talking about, the one that is expected first to arrive in Nigeria in a couple of weeks. There are other candidate vaccines that will come on the list over the next few days or weeks after the strategic advisory group of experts of WHO reviews all the evidence. So the process is for WHO to review rigorously all the evidence published or made available by the vaccine manufacturers. And after reviewing that evidence, there is a set of criteria, then can decide whether or not WHO can endorse it or put it on the emergency list. So for now, as of now, it's one of them, but there are others that may come to on the same list. Now, the difference between efficacy and effectiveness, the efficacy is related to the result we get under the trial condition. So it's a controlled environment. We administer the vaccine to, say, 3,000 people. One group divided into 2. One received the actual vaccine. The other one received the placebo. And then we follow either the incidence of the disease or infection in comparing both groups. And based on the difference between the incidence of the disease, we draw conclusion on the efficacy. But it's on trial condition. It's a tightly controlled. Whereas effectiveness is related to the result under the real condition, like people living in the communities. Because that's not a controlled environment. Because you can have people who refuse to take the vaccine because of vaccine hesitancy. You can have the vaccine available, but you can't get them to the people because there are logistic issues. So overall, it will depend on the coverage of how many people have been reached actually by the vaccine to draw the effectiveness. And it's the effectiveness that can lead to herd immunity. The efficacy, it's really a very controlled environment, and we cannot predict that it will work. If they say the vaccine is 95% efficacious, it does not mean that we will get the 95% of the population protected. You have to reach the actual coverage to reach that type of result. So the real difference is between the trial condition, the clinical trial condition, versus administering the vaccine in the real world. We've all, overcoming all the challenges, logistic acceptance, etc. Thank you.
Thank you very much, WHO country rep.
Nigerians that we are transparent with the things we do. Honorable Commissioner for Health, Cross River, we truly appreciate your presence and your perspective of what you're doing in your state. When we speak about the need to have everybody on the same page in terms of our national response, it's born out of the fact that we share responsibilities with the subnationals. It's not as a result of any either supremacy or superiority contests. No, we share responsibility, particularly in the areas of education and health. These are two items, very vital social items that are on the concurrent legislative list. At every stage, the states have their responsibilities, the federal has its own responsibility, and even the local governments. With health, primary healthcare system is the responsibility of the local governments. But as an interventionist agency, the federal government created the National Primary Healthcare Development Agency. It's an interventionist agency. When you come to the state, all general hospitals, the secondary health institutions are the responsibilities of the states, not that of the federal government. The federal government has a responsibility for the tertiary hospitals, the teaching hospitals, the federal medical centers that they have put in place. So it's always a shared responsibility. And that is why we advocate for states to key into the processes that we are putting in place. One, you reduce costs. You share the responsibility, you share the burden. That is the reason why the president approved 50 billion to the states. All the states took at least 1 billion as an intervention from the federal government for them to prepare and key into the response. So we are not in any contest. When you come to the education sector, it's the same thing. Federal government has a responsibility for tertiary institutions. Now states even have created tertiary institutions, the universities, the colleges of education, the polytechnics. Secondary institutions like secondary schools, teachers' colleges, and the rest, in places where they still exist, are the responsibilities of the states. Federal government has also intervened in that area by the creation of different institutions, SUBEG, TED-FON, and other institutions that are helping to build capacity. And as a federation, we have synergy in doing things together. So my sincere appeal to members of the fourth rank to also look at it from that particular perspective, that everything we have been speaking about in the last 7-8 months is to drive everybody in a certain direction. That what is being done in Lagos is similar to what is being done in Sokoto. There might be geographical reasons that would call for adaptability of the processes. When we spoke here, the day we released the new guidelines and said educational institutions should go on break from the 18th of December until the 18th of January, it was based on the information that we received as a result of interface between the schools, proprietors, the state governments, and the Federal Ministry of Education. So it wasn't a figure that we picked out of the blues. It was an informed figure, and it is always advisory, because those advice are always based on science and facts. This is what is happening. If you continue along this path, this is what will be the eventual outcome. We've said it consistently here, that the activities of the festivities of the Christmas and New Year period, we will begin to see the repercussion. And we have started. And I'll be bold to say that these numbers are not going to abate as long as we continue in the manner in which we are responding to the pandemic. Truly, I mean, there's no shame or there's no stigma about COVID-19. Even established democracies that have existed in the last 300 years, the strongest of all the economies, are battling with COVID-19. As of today, the world's record in terms of infection cases is over 86 million. USA alone, the strongest country in terms of military, in terms of economy, in terms of the length of its democracy, has over 21 million. But what's the taboo about it? What's the shameful thing about it? As a country, we've done the best that we needed to do in our earlier stages of the response. And I'm bold enough to state that as of today, the world is copying the things that we did several months ago. I have a friend, a Chinese friend, who has traveled home. And I thought this friend would have been in China by now, because the journey started almost 3 weeks ago, just to get information that the person is stuck in South Korea, quarantining for 2 weeks before qualifying to fly into China. And when that happens, the person told me that it's not likely they will be home until the 19th of January. This trip started since December. So there are countries that are very serious with their protocols, for the simple reason that they need to protect their human assets. The human assets are the human beings. And that's the greatest assets that a nation can have. And everything that we've been doing all this time is to provide a protocol that will work for our people and protect the lives and the livelihoods of our people. And we will continue to enjoin the nationalities, the states, to key in. This thing is real. And you know that I will never shy from giving you examples of myself. Up till this moment, now in response to whether people who have guarded themselves, Mitare, you asked that question, they end up eventually getting infected. Everything humanly possible I did around my household. From March to the end of November, I didn't have a single infection, except for a driver that we had asked to go home when we were downsizing, even our domestic staff and our personal aides, which we even did in our government offices. I got that infection, only one. from outside. But in the second week of December, I woke up to the greatest shock of my life. I've shared this. But that's not the end of the story. I ended up with 9 infections. The first test, 6 returned positive. The second test of the people that live in the domestic part of the house, 3 came in with a 1-year-old. So I had 9 under my care and cover and under my roof. The greatest shock I got, I've not shared this. I decided, okay, let me also run a test around my household in Yola, because I come from Adamawa State, and see what it would indicate. To my greatest shock, when I was thinking about, okay, I couldn't go anywhere for Christmas, I couldn't enjoy the Christmas because my children, along with other members of my household, just came out of care on the eve of Christmas. So there was no way I could do anything, just to quietly and prayerfully celebrate the Christmas on Christmas Day. I decided to ask that members of my household in Yola be tested. Everybody that comes around in terms of provision of security, my drivers, my cook, my house helps, people who, my protocol officer and the rest of it. To my greatest shock, 25 were tested. I got a standing call from the medical director of the Federal Medical Center, Yola, asking me not to come home. And I said, why? He said, I'm shutting down your house. I said, what for? He said, out of the 25 samples we took on the 23rd, because of the Christmas period, we couldn't run the test and have the results back. Out of the 25, 13 came back positive, including your cook. I'm saying this and I'm sharing this on national television so that people can be serious with their lives. I didn't go to Yola to conduct the test. I'm busy battling with what has happened to me here in Abuja. And I just asked the officials in Yola to help me run a test. And I said, okay, run another one from another household, where I would definitely visit when I go to Yola. 3 came back. So I had 16 to deal with in Yola. I was busy calling up and down to see if they could get a place in the treatment center. Friends, COVID-19 is real. And what you do with it will determine how you survive. God has truly been graceful and merciful to Nigeria. And like Dr. Sani rightly said, we don't have the statistics, please. We should stop fooling ourselves. If we recorded in 1 week 57 deaths, because of our poor statistics, up till now as a nation, we don't even know our number. So how do you get the records of deaths? You can be rest assured that you can multiply that conveniently with 3 or 4 to get the actual figure and the statistics of the death recorded that week. So it's no joke, and it's no fun. We have to get serious with this matter. Our response as a people, as a nation, as individuals matter. I'm not a prophet of doom, but if we continue on this particular trajectory, we will soon be overwhelmed. We will soon be overwhelmed. I was listening to the CNN report this morning before I left my house. In the Los Angeles County area, by their statistics, for every 33 seconds, 1 person dies. So, what do you do? What do you do? And this is a place where they have infrastructure. And I was also, one thing that really dampened my heart was the fact that there's a conscious decision now. Every medical officer or clinician has to make, as to prioritizing those that are likely to leave, to be brought into care or allowed to die. I think for medical doctors, that's one of the most difficult decisions you can ever take, to prioritize who you would attend to. I don't want us to get there. But right now, we are gradually niching towards that. If we don't do something quickly. And honestly, my appeal, Commissioner Health, Cross Rivers, you are the chairman of the Forum of Commissioners of Health. Tell your people to open up the isolation centers and begin to test. Because if you do not test, you will not know. If you don't test, you can't find. And it is just appropriate to find the people. This 13 in my household, if we had not taken them into isolation or treatment, they will be busy moving around and spreading the thing. The next time a test is going to be conducted, the remaining 12 that did not test positive will test positive. That's how we grow the figures. And nobody, Chukwe has no business. He has no business creating figures. He has no business generating figures. What would he do with the figures? Is it to compete with countries that are recording 21 million? So let's get serious with this business. Thank you, and have a good evening.
Thank you very much.
Chairman, PTF, Honorable Minister, here members of the PTF, our sister, the Commissioner from Cross River, and the CG, Nigeria Immigration Service. Good evening, everybody. The press, we appreciate you for being here with us. It has been well spelled out, the challenges we're having in the country. But first and foremost, we have to thank God that we're able to survive the year 2020. And our prayer is that you continue to maintain all those techniques and all those protocols that saw you through to 2021. We hope that will be done. We've been reminded about travel defaulters and the penalty they are suffering right now by imposition of restriction on their travel for the next 6 months. So it is advised that when you travel home, please on day 7, present yourself for the mandatory test so as to continue to be allowed to make another trip. You've been told that PTF will ensure that all the travel protocols are strictly observed. So it is left for you to know when to comply, and it is left for you to determine whether you still have room to travel again. You've been also told that the next feature for travel is health, and as such, you should be healthy to be able to travel. You are reminded that all COVID-19 related symptoms should subject themselves to testing. And of course, the symptoms have been mentioned to you again. You talk about high fever, talk about cough, respiratory challenges, and of course, loss of taste or smell. When you have any of these symptoms, please present yourself for tests. And that is the only way you can save your life and save that of your relations or friends around. We have to note that vaccines are not yet here with us. So the only vaccine we have right away are the non-pharmaceutical interventions. And of course, you'll be reminded again that the non-pharmaceutical interventions include regular hand wash, use of alcohol-based sanitizers, social distancing, and of course, wearing your mask in the right direction. It is not chin mask, it is not head mask, it is face mask. The the state governments are also advised to ensure strict compliance with all these protocols. State governments are also advised to set up task force that can enforce wearing of masks, especially in public places. You also reminded that testing remains critical in our fight against COVID-19. So state governments, you are advised to embark on aggressive testing to make sure that you dictate this virus at an early stage and will be able to manage the crisis. Note, please, that people of 50 years and above have the risk of dying from COVID-19 in Nigeria. The chances are 1:5. And of course, this means that the best way to protect your life is to assume that everybody you meet on the road or you have contact with is COVID-19 positive. So in that case, our people say that a problem identified is half solved. While we are doing our best to protect ourselves, please be consistent with the protocols. Because if you drop or lower your guard at any point in time, you cannot predict where the virus will be contacted. And of course, finally, you have to observe all the necessary non-pharmaceutical interventions for us to continue to remain alive in 2021. And as you do this, we wish you the best of luck and hope that this curve will eventually be flattened. God bless you. Until we meet again on Thursday, have a safe week ahead. Thank you.